Good afternoon. The press briefing will begin in 5 minutes.
For those that are tuned in, we have just a few minutes. We'll be beginning our live stream press briefing, so we'll give just a couple of minutes for others to join us, and we'll be beginning shortly. Good afternoon, everyone, and I'd like to introduce myself. I am Kirk Crandall, Chairman of the Allegheny County Board of Legislators, and what we have this afternoon is a brief live stream press briefing, and the intent is to bring some information from those that are on the front lines, our EMT services, our hospitals have been overwhelmed and busy with COVID-19, and we thought that it would be good for everyone to hear directly from them and be able to discern for yourself what's right for you and your family. And we want our friends and neighbors to have the correct information and have it firsthand, and we thought that this was a good way to bring that forward. We've had a couple of legislative meetings, committee meetings, where some of this has been presented, and it was really an eye-opener for our legislature. So I'd like to, at this time, introduce Scott Lamphere. He is Operations Manager and an Advanced Emergency Medical Technician from Medical Transport Services. These are the ambulances that you see running around the county with MTS on them, and he's going to share a little bit about how the effects have been from COVID-19 on his business. So, Scott?
Thank you, Chairman Crandall. I just want to briefly discuss where COVID-19 has landed EMS in Allegheny County. At this point, I would be speaking for all providers, both commercial agencies as well as our volunteers. We're tired. The provider fatigue at this point, we've been running a marathon for 2 years, and the requirements can make us continue to run. Our agency alone has seen an 87% increase in patient transports over the same 3-month period that we had pre-pandemic. Things that cause continued stress on our agency and the volunteer agencies are the increased wait times at hospitals, delays and diversions. Those were terms, if you were in this field 5 years ago, you would see in the big city hospitals. Unfortunately, today we're seeing them here locally. At no fault of any local agency, just at the point that we're all tired. We're trying our best and we're working as hard as we can. Again, I just want to emphasize, pre-COVID, an ED wait time at our local hospitals was absolutely unheard of. Recently, we've seen an increased EMS request for patients with difficulty in breathing, chest pain, and probably the scariest one is out-of-hospital, at-home cardiac arrest. Recently, over the past few weeks, we've seen greater than 5 at-home cardiac arrests in a week's period, which is unprecedented. While this can all be tied to COVID, the facts still remain. It puts a burden on us and the system. I just want to quickly speak to some trends that we are seeing. These aren't national trends or only national trends. These are trends we see. Ages suffering from COVID-19. It's not affecting one population. It's affecting everyone, all Allegheny County residents, in some way or another. Cardiac arrests and deaths of Allegheny County residents have been experienced across multiple facets of ages, from middle-aged to elderly patients. And we're also seeing entire families contracting COVID-19, leaving little to no help when they fall extremely ill for the rest of their family. Patients are continuing to experience severe symptoms even after the contagious period. Day 15, day 16, patients are still suffering from severe symptoms that are requiring EMS attention and sometimes transport to hospitals. In conclusion, I just want to stress that our county healthcare infrastructure will continue to struggle if we do not make some changes. What we're asking you to do is do your part. If you can get vaccinated, please do. If you can wear a mask when it's appropriate, please do. And if you can stay home when you're sick, that would be the biggest help to us right now. If our EMS system fails, who will answer your call for help? The message to take home today is you, as Allegheny County residents, have to make some changes to help us help you. Thank you, Mr. Chairman.
Thank you, Scott. And Scott was in the other day at one of our committee meetings, and like I say, it was a real eye-opener to hear some of the information that he shared. Meeting with us not long ago was James Helms, CEO of Jones Memorial Hospital. You've put out information about the condition of the hospital and where you're at, but for the folks, this is an up-to-minute of what your situation is, and we thank you for coming in and sharing that with us today. So James Helms, CEO of Jones Memorial Hospital, the floor is yours.
Thank you, Chairman Crandall. I'd like to first start by just commending both the staff of Jones Memorial Hospital as well as our first responders in Allegheny County, a large number of whom are all volunteers. Their dedication to this community is second to none. On October 12th, I presented that in September, we were seeing a dramatic increase in the volumes of COVID and, unfortunately, corresponding reduction in the available beds across our entire region in the hospitals. At the same time, we had predicted that following the holiday, if we had no change in our actions, we would see an increase in COVID across their region. Well, that spike is here now. And without any change in what we're doing on a day-to-day basis, we'll see another spike following the Christmas holiday. We've brought with you some real-time numbers up to date with comparable periods that we're seeing at Jones Memorial. Over the period of 3 months prior to this surge, from 6/1 through 8/31, we had COVID-positive patient admissions of 17, which constituted 69 patient days at the hospital. And over the last 3 months, we've had 133 COVID-positive patient admissions, culminating in over 1,000 patient days of patient care. Also, prior to the surge, 3 months, we've seen 12. Vaccines have been proven over and over with the data to prevent serious illness. Out of the admissions and fatalities, 74% of those were unvaccinated. The average age of unvaccinated fatalities is over 90 years old and have all been in their 90s, while fatalities have ranged anywhere from their 30s through their 90s. This is data in your own backyard in your community hospital that's showing the effectiveness of vaccines. Since September 1st, Jones Memorial has not seen less than 50% of the medical patients being COVID positive. We've been as high as 68%. This morning, we started out with the community infection rate is having an effect on our staffing as well in the hospital. You can see here that during the last 3 months, we've had to have 47 employees requiring time off due to COVID exposure for a total of almost 400 work days lost. At the same time, we're seeing this COVID burden on the hospital. Additionally, 3 employees have had to ask for time off for care of their families because they too have a life that they're trying to live. So for the care of their children, we've lost another 45 days of patient care and hospital work time. We presented you here the number of staffed beds that we can provide now at Jones. I can tell you that we've been running 120 to 130% of those beds continuously over the last few weeks, with an increase of patient to nurse staff ratios. Again, I can't speak highly enough for the work of the staff that have been doing, but I will share, as Scott shared, that they are feeling the fatigue from this COVID burden. They continue to return to their shifts and extra shifts day after day, knowing exactly what it is they're going to come into to take care of the community. So I ask that you please support not only your community hospital, but the staff who are your friends and neighbors, and please get vaccinated. Thank you, Chairman Crandall.
Thank you, Jim. And at this time, I'd like to, when I first said we're going to have some on the front line that are here, you can't get any more front line than what we're going to hear from next, and that is Dr. Jackie Anderson, who is in the emergency department at Jones Memorial Hospital. And as we tried to put this together, it was truly an effort to have Dr. Anderson step away from that position and come in here for a few minutes for an update and sharing some information with us. So, Dr. Anderson, thank you for being here.
Thank you, Chairman. I'd like to speak to the public today about the recent and current situation in the emergency department at Jones Memorial Hospital. We are seeing an increasing number of patients in the emergency department over the past several months. The volumes from September through November have exceeded last year's numbers from the same months by nearly 200 patients per month on average. As Jim mentioned, the number of admitted COVID-19 patients has increased nearly eightfold from September through November when compared to June through August of this year. Every patient who is admitted is first seen in the emergency department, and life-saving oxygen is provided for dangerously low oxygen levels due to COVID-19. Some of these patients are putting breathing machines, also known as ventilators, as a form of life support. Additionally, many of these patients also experience kidney, liver, heart damage as a result of COVID-19. We are also seeing patients who have had COVID-19 several months ago and are still experiencing fatigue, weakness, and shortness of breath. While 21 patients have received monoclonal antibodies at Jones Memorial Hospital, this treatment is absolutely not a substitute for vaccination. Regarding the impact on the emergency department and our staff, I was working yesterday, and at one point we were holding 11 patients who were admitted to the hospital, but we were unable to find a bed for them on the floor. In our emergency department that has only 9 beds. Again, that is 11 holding patients in an emergency department with only 9 beds. 9 of those 11 patients had COVID-19, and all of them required oxygen. The majority of those patients were unvaccinated. Wait times are increasing as a result of COVID-19 severity and needing to hold patients in the emergency department due to a lack of resources. Remember that as an emergency department, we must still be prepared to treat other life-threatening emergencies even when all of our beds are full. These numbers are unprecedented for Jones Memorial Hospital. Regarding patient transfers, oftentimes we need to transfer patients for a higher level of care to other facilities, or simply because we do not have beds in the hospital. This is becoming increasingly difficult to do as other hospitals in our region are experiencing the same burdens. This means that your loved ones, whether they are being treated for COVID-19 or another medical emergency, may be transferred to other hospitals, some of them several hours away. I cannot stress enough the importance of vaccination against COVID-19. This virus is dangerous, and it is killing members of our community. We know that vaccines prevent severe disease. Nurse practitioner and physician's assistant at Jones Memorial Hospital was vaccinated before any vaccine mandates were implemented because we have seen firsthand how awful this disease is, and we trust this vaccine. Again, COVID-19 is putting an incredible strain on our resources, and data shows that overcrowding as a result of COVID-19 admissions is preventable with vaccination. For those of you who are vaccinated, we cannot thank you enough. Please seek booster vaccinations if you have not already. They are widely available for New Yorkers 18 years and older and are strongly encouraged by both the CDC and New York State Department of Health to maximize your protection against this deadly virus. Also, please encourage others to get vaccinated. For those of you who are not yet vaccinated, please do not make a decision to avoid vaccination without consulting your primary care provider. This virus is dangerous, and the choice to remain unvaccinated endangers both you and the lives of those around you. Your primary care provider will be able to point you toward reputable sources, such as those that he or she uses to provide other medical advice to you. Unvaccinated individuals who have had COVID-19 should also seek vaccination to increase your protection. These vaccines are safe and have undergone and continue to go the most intensive safety monitoring in the U.S. history, and over 459 million doses have been given to U.S. alone. Lastly, I would urge you not to avoid care. I know that I have outlined a very serious situation in both the healthcare system as well as in our emergency department. While we ask that you visit your PCP or a walk-in clinic for mild emergencies, please do not avoid seeking emergency department care for life or limb-threatening emergencies. We remain dedicated to your safety, and providing quality care continues to be a priority. Thank you, Chairman.
Thank you, Dr. Anderson. Thank you for taking out time out of your busy day to be here and share information with the folks at home. Next, we have our Allegheny County Public Health Director, Tyler Shaw, and Tyler has been, as these other folks up here, for going on 2 years now, right on the front line, and it's just a 24/7 situation of information and contacts and keeping on top of the situation for us here in Allegheny County. And I certainly want to thank you, Tyler, for all that you have done. And you have some information that you would like to share as well. Thank you.
Thank you, Chairman Crandall. Thank you all for tuning in to this press briefing regarding COVID-19 situation in Allegheny County, New York. The situation warrants new tactics, which is why we're reaching out to you via this platform. So I'm guessing some of you are asking the question, why now? Why is this important to put this information out to the public now? Well, the simplest answer we have is we're making this plea to our communities across Allegheny County that with the rise in case counts and hospitalizations and serious illness and complications due to COVID-19, that this is a serious situation. We have the lowest vaccination rate in the state. We are all feeling COVID-19 requirement fatigue. We're all feeling COVID-19 fatigue in general, burnout amongst our emergency services personnel, our hospital personnel, our nursing home personnel, certainly my public health staff. It's a reality in this situation. And the death count continues to rise. Next, please. The health department strongly recommends that each and every individual above the age of 2 wear a mask when occupying indoor spaces. This is one free and simple way, coupled with other public health measures that can lower your risk of becoming a COVID-19 case. Get tested if you feel ill. We have free testing clinics going on every Monday and Wednesday from 7 to 9 a.m. at the Belmont American Legion. Even if you feel sick or you think it's just a head cold, we advise you to seek testing. At our most recent rapid testing site, we identified 28 positives out of 55 individuals tested for more than 50% positivity rate. You see these positivity rates on the screen up here, 13.3% from the state's reported numbers. Likely those numbers of our community transmission percentage rates are higher due to at-home testing. Just wearing your mask without following other protocols is not enough. You need to get vaccinated. Wear your mask. Limit your social gatherings. Wash your hands, and stay home if you're sick. The graph above does show some a COVID-19 positivity rate in Allegheny County over the past 3 months. We can see that it's steadily increasing. We have seen this increase in cases, most likely due to highly contagious Delta variant and individuals moving indoors. Next, please. We've looked back at some of our data going back to November 30th on cases and vaccination status versus unvaccinated status. So you can see these numbers here that shows at the time we have not analyzed the booster data on these fully vaccinated population. On 12/1, we did have several families. That's why the numbers look a little bit closer. We did have several families that had constant exposure to COVID-19 in the home. We are recommending that you do limit your social gatherings. We are seeing some spread across funeral services, birthday parties, sleepovers, and other intimate gatherings where people are brought in close contact with one another. According to the New York State level data, fully vaccinated individuals continue to have an 89 to 95% reduced risk of becoming hospitalized due to COVID-19 compared to those who are unvaccinated. Fully vaccinated individuals have a 78% lower risk of becoming a COVID-19 case compared to unvaccinated individuals. The reasons for vaccine efficacy waning is still unclear, but likely due to declines in community and immunity over time. Increased levels of variant circulation and our low vaccination rate overall. Data is now currently insufficient on the antibody titers. I know those were some questions we've had from the public in the past. The data is just not out there yet. They are working closely with CDC and state health officials. But as new variants emerge due to lower community protection, we will likely see vaccine efficacy wane. Studies continue to show that even if you've contracted COVID-19, that a vaccine provides even greater protection after infection. Next. Here's our current overall fully vaccinated percentage rate as of Saturday, 41.78%, with the state average sitting at 68.7%. Here's some of our communities with the lowest vaccination rates. Some of our communities that have the greatest vaccination rate, which is over 50% right now. include Angelica, Candidia, Ceres, and Alfred Station. We encourage each and every resident to get vaccinated as quickly as possible. If you are unsure whether you should get your vaccine or it's not based on a medical condition, please talk with your healthcare provider. The way out of this pattern that we are currently in with increased hospitalizations, serious illness, and death is to get additional residents vaccinated as quickly as possible. If you have not received your booster dose yet, we continue to add additional slots for our booster clinics, which can be located on the internet. If you do need assistance, we have a resource slide at the end of this presentation as well. Next. You can see the trend, the trajectory of our deaths continue to increase along with the number of our hospitalizations. We've seen some time and time again that with increased community transmission rates, we see increased hospitalizations and increased deaths. The transmission and case counts for COVID-19 and low vaccination rates have an impact on our hospitalizations and deaths within Allegheny County. With a lower rate, our communities are more susceptible to hospitalizations and serious illness. We are seeing younger and younger individuals becoming seriously ill who are not vaccinated. You can see the average age in 2020 for deaths was 77. We crunched this data based on using 2020 as everyone was considered unvaccinated. The vaccine wasn't widely distributed in Allegheny County, so we did crunch those numbers, and the average age of our deaths was 77. Fast forward to 2021, our unvaccinated average age of death is 69. So we're seeing a decrease in our unvaccinated population. 21, our average age of our deaths for our vaccinated individuals was 82. So we're seeing that actually has increased. So we're seeing that the vaccine is effective at preventing deaths, and if there are deaths that if you're younger, you are less likely to come down with serious illness. Next. Lastly, get vaccinated as soon as possible. We have our link up here. There's actually 2 links up here to find and locate a vaccine near you. We ask that you wear your mask when you're in indoor spaces. Limit your social gatherings if possible. Wash your hands. Stay home if you're ill and get tested. Free testing is available and our link is up here as well. And if you haven't received your booster already, please consider getting your booster as soon as possible. While the vaccine is not 100% effective, which is why other layered strategies must be undertaken by residents, it does offer the greatest level of protection. If you have not signed up to, we are in this together. It's not just a saying that we use on paper or in passing. If we plan to get out of this pandemic, we have to move forward as one unit, one county, one community. Thank you.
Thank you, Tyler. And this is going to conclude our COVID-19 live stream press briefing. This is going to be available at our Allegheny County website, and we're hoping that this gets pushed out by folks at home looking at this and can be shared and spread. I certainly want to thank those that sat in on this panel today, very busy people that are truly on the front line of the COVID-19 situation here in Allegheny County, along with their staff. And we heard that people are getting tired. Those that are in the healthcare profession are getting tired. This is going on 2 years now that we've been dealing with this. And I want to thank personally the staff and those that work with you folks to protect our friends and neighbors. Message is, listen to healthcare professionals, whether it's these folks and the message that they brought or your own healthcare professional. Get vaccinated and be protective of yourself and your family. With that, I want to thank you once again, and thank you folks for watching and getting some factual information. Thank you.